So today we will be talking about coronary circulation, that is the heart's intrinsic circulation. Okay, heart's intrinsic circulation. So from my previous classes I have already explained that the major pressure head, mean arterial pressure, that determines your perfusion pressure. All of your organs need to be perfused, all of your organs need to get oxygen, blood supply and the supply of essential nutrients, right. So similarly, heart as a organ, it also needs its own blood supply. Okay, it has got its own requirement of oxygen, carbon dioxide, washout, and definitely the nutritional requirements as well, right. Heart supplies blood to everybody else, all the organs, but it itself requires blood, right. So how does that circulation takes place? That circulation is essentially called the coronary circulation. And from your anatomy knowledge, part is over, right, in anatomy. Okay. So from your anatomy knowledge, you know that the major two arteries, the right coronary artery and the left coronary artery, these two arteries are responsible for blood supply to myocardium, right. Now as you know that your left ventricular muscle mass is more than the right ventricular muscle mass, as because your left ventricle works against the systemic vascular resistance and your right ventricle works against pulmonary vascular resistance. And as you know that resistance in the systemic circulation is much higher than the pulmonary circulation. So it is very easier for the right ventricle to pump blood into the lungs, but it is very difficult for your left ventricle to pump blood into the systemic circulation, right, because the resistance is high. And simply if you work against more resistance, there will be more muscle mass. Okay. Say for example, simply if you lift 10 kg weight, you grow your flexor muscles, biceps, brachialis, right. If you lift 30 kg weight, there is bigger muscle mass, right. So simply your left ventricle is working against much more resistance, that is systemic vascular resistance. Sometimes we will calculate how to compare the resistance between the systemic circulation and the pulmonary circulation. Okay. So if you compare the resistance, it is much higher in the systemic circulation. So your left ventricle needs more muscle mass to pump blood into the systemic circulation, and as a result, to feed that muscle mass, you need better circulation. So your left coronary artery, it divides into the circumflex artery and the anterior descending artery. Okay. So anterior descending artery and the circumflex artery, these two are the branches of left coronary artery. I guess you know from your anatomy knowledge, right. And the right coronary artery, majorly it supplies the right ventricle. And what is the origin of those arteries? Yes, base of the aorta. Okay, base of the aorta. For blood supply to all organs, the major pressure head is mean arterial blood pressure, right, mean arterial pressure. And I guess all of you know how to calculate mean arterial pressure. It is diastolic blood pressure plus 1/3 of pulse pressure, okay, DBP plus 1/3 of pulse pressure. Okay. So if you calculate it, considering your systolic blood pressure as 120 millimeter of mercury and diastolic blood pressure as 80 millimeter of mercury, it will be coming as 80 plus 1/3 of 120 minus 80, that is 80 plus 1/3 of 40. Okay, and it will come to 93.3 millimeter of mercury as mean arterial blood pressure. And maintaining a mean arterial blood pressure is quite essential for perfusing all your organs. Maybe it's kidney, it's heart, it's lung, it's brain. So everywhere you need mean arterial blood pressure, which is very essential to perfuse that organ. Okay. But some organs, say for example brain, okay, heart, it has got an internal pressure which is acting against the mean arterial blood pressure. Okay. So mean arterial blood pressure is trying to perfuse that organ, but the internal pressure of that organ is resisting mean arterial blood pressure. Okay. So the major perfusing pressure, what you need to calculate is the perfusing pressure, and it is essentially the mean arterial pressure minus intra-organ pressure. Okay. So let us for an example. So this is an organ, whatever be the organ, it may be heart, it may be brain or whatever, right. So it has got an internal pressure. Okay. So intra-organ pressure, we are calling it intra-organ pressure. Okay. And we have got blood supply to this organ and this blood supply is happening because of mean arterial blood pressure, okay, and this organ has got an internal pressure, okay, this organ has got an internal pressure and this pressure is working from inside to outside, okay, it is an hollow organ, right, it is an hollow organ, and intra-organ pressure is the transmural pressure which is acting from inside to outside and it is actually resisting mean arterial pressure, okay. So, if we call it intra-organ pressure or IOP, intra-organ pressure, right, to perfuse that organ. So, mean arterial blood pressure is trying to send blood to this organ and intra-organ pressure it is trying to resist it, right, it is trying to resist it. So, the pressure head, mean arterial blood pressure minus intra-organ pressure, okay. Once this is positive, there will be blood supply to that organ, okay, and once this is negative, that organ will suffer ischemia, right, getting my point. So, almost in all organs mean arterial blood pressure is the perfusion pressure which is trying to supply the organ blood, supply with blood. But when intra-organ pressure is increasing, right, intra-organ pressure is increasing and it is overshooting mean arterial blood pressure, it is more than mean arterial blood pressure, there will be no blood supply to that organ, okay, there will be no blood supply to that organ, and somewhat if it is negative, blood supply will be in the opposite direction, okay, some blood will be washed out from that organ, getting my point. And once mean arterial blood pressure is equal to intra-organ pressure, they will cancel each other and there will be no net blood supply to that organ, clear. Say for example, brain, okay, so we have intracranial pressure, okay, we have intracranial pressure, okay. Now this intracranial pressure, it is resisting blood supply to brain, right, intracranial pressure, it is resisting blood supply to brain, okay, and mean arterial blood pressure is trying to send blood to brain, okay. So, the perfusion pressure which is actually perfusing your brain is the difference between mean arterial blood pressure and intracranial pressure, MAP minus ICP, intracranial pressure, okay. This is why when intracranial pressure is high due to any reason, okay, there may be hemorrhage, there may be tumor, when there is intracranial pressure is high, right, what will happen? The brain will suffer ischemia, right, less blood supply, okay. So, we need to maintain the perfusion pressure to perfuse all the organs. Similarly, for heart, there are multiple pressures operating during systole and diastole, intraventricular pressure, intra-arterial pressure. If we compare between left ventricle and right ventricle, they have different pressure, intra-organ pressure, right. Intra-organ pressure, intra-left ventricular pressure is quite higher than the intra-left ventricular pressure is higher than intra-right ventricular pressure, right, you know, okay. So, remember perfusion pressure is equal to mean arterial pressure minus intra-organ pressure, okay. If it is heart, then perfusion pressure of heart is equal to mean arterial pressure minus intraventricular pressure. If it is brain, if the organ of our consideration is brain, then perfusion pressure is equal to mean arterial pressure minus intracranial pressure. Clear? This concept is clear? Okay. Now, we will talk about an MCQ, very simple MCQ, okay. So, it tells that a mother informs the pediatrician that she wants to hold down her daughter during venipuncture since the girl is extremely fearful of needles. When the girl sees venipuncture needle and becomes anxious, which of the following circulatory bed will respond with minimum % decrease in blood flow compared to pre-stimulation? समझ में आया कुछ? नहीं. Okay. So, there is a little girl, okay, who is afraid of needles, okay. She is afraid of needles. Her mother is trying to console her, but she is really very much anxious and very much afraid of needles. Okay, so when the girl sees venipuncture needle, যখনই ও needle দেখে, ঠিক আছে, when the girl sees venipuncture needle and become anxious, which of the circulatory beds will respond with minimum percentage decrease in blood flow compared to pre-stimulation? That means whenever someone is anxious or afraid or any excitement, what happens? What happens first? Whenever for any reason একটা নিডল দেখে ভয় পাচ্ছে, ঠিক আছে, সো আমরা যে কোনো কারণে যদি ভয় পাই, ঠিক আছে, বা অ্যাফ্রেড হই, সো something happens in our body. What is that? Yes, yes, adrenaline বেরোয় তো, তো তাহলে কি স্টিমুলেশন, ওটাকে what kind of stimulation is that? Sympathetic stimulation. Okay, and what is the function of sympathetic stimulation in your body? Yes, increase heart rate, number one. Yes, vasoconstriction. Okay, vasoconstriction, right? Okay, now if I'm anxious and I'm frightened, I'm afraid, okay, I'm in excitement, my sympathetic stimulation will be high, right? Sympathetic stimulation will be high, and as a result of sympathetic stimulation, my heart rate will increase, okay, due to the effect of adrenaline, noradrenaline, whatever, right? My heart rate will increase and my blood vessels will constrict everywhere, okay, everywhere, you know, okay. So my blood vessels will constrict. Now if my blood vessels are constricted or there is vasoconstriction, there will be difficulty in perfusion, okay, there will be difficulty in perfusion. Even if my mean arterial blood pressure is okay, my intravascular or intra-organ pressure is okay, the pressure heads are working naturally, normally, but due to vasoconstriction, blood supply will be less to the organ, okay, all the organs, because vasoconstriction is happening throughout my body, okay. So kidney will receive less blood, liver will receive less blood, my skin will receive less blood, okay, my heart will receive less blood, my brain will receive less blood, all of my organs will receive less blood because of vasoconstriction, right? Now this question asks, if I consider cerebral circulation, coronary circulation, cutaneous circulation, circulation in the skeletal muscle, circulation in the pulmonary bed, circulation in the kidney, circulation in liver, whatever, hepatic circulation, renal circulation, which circulation is least affected, okay, which circulation is least affected by sympathetic stimulation? মানে সব জায়গায় ব্লাড ফ্লো কমে যাচ্ছে, কিন্তু কোন অর্গানে ব্লাড ফ্লো প্রায় নরমাল থাকছে, অল্প কমলেও প্রায় নরমাল থাকছে? This is the question. Now what is your answer? Now again read the question carefully. Okay, when the girl sees venipuncture needle and become anxious, which of the following circulatory bed will respond with minimum percent decrease? Okay, see, circulation is or perfusion is supposed to fall for all organs, but which organ is resisting it maximum? Okay, or which organ, in which organ there is minimum decrease in the blood flow? So that essentially means these two organs are very vital organs, okay, যেখানে blood supply কম হলে চলবে না, ঠিক আছে, okay. So with minimum percent decrease in the blood flow compared to pre-stimulation, and the answer is, okay, cerebral and coronary circulation, okay, okay. Now come to coronary circulation. Okay, you will be able to answer this question after this session, okay. So I am skipping this slide, but please read out the question, okay. The figure shows the brachial artery pulsation, the figure shows brachial artery pulsation or pulse pressure tracing during one cardiac cycle, okay, during one cardiac cycle, at which point of the following from A to E is the left ventricular coronary blood flow highest, okay. আচ্ছা, arterial pulse আমি পড়িয়েছিলাম, বাট হয়তো একটা ব্যাচের বা তিনটে ব্যাচের, I don't remember, right? So this is the arterial pulse tracing. This point C is the beginning of diastole, okay, and this one is dicrotic notch, okay, this one is dicrotic notch, okay. this one is dicrotic notch. This part is systole, A to C is systole, and after C it is diastole. Okay. This is arterial pulse tracing, and this question is asking during systole and diastole, okay, 0.3 second systole, 0.5 second diastole, within this 0.8 second, at which point left ventricular coronary artery flow is highest. Okay. কোন সময় left ventricular blood flow highest থাকে, মানে simply left coronary artery দিয়ে. Okay. Answer is C. Now why it is C? I'll come to it. Okay. So these are the arrangement of blood vessel in myocardium. Okay. These are the arrangement of blood vessel in the myocardium. These are the contracting myocytes and they are collapsing blood vessel. When your ventricle is contracting, the blood vessels are in between, entangled in between the cardiac myocytes. হার্টের যে মাসলগুলো আছে সেই মাসলের ফাঁকে ফাঁকে ব্লাড ভেসেলগুলো ঢুকে আছে, entangled হয়ে আছে, right? Now when your ventricle, left ventricle or right ventricle is contracting, they are squeezing these arteries, okay? And this is the major problem for us, right? So contracting myocytes collapse blood vessels during contraction, okay? And during this contraction, arterial blood is forced backward towards the aorta, okay? As you know, the coronary arteries which are supposed to supply your myocardium, the left coronary artery and right coronary artery, they are supposed to supply your myocardium and they are originating from the base of the aorta, root of the aorta, right? So essentially it is the aortic pressure which is required to supply your myocardium, okay? তার মানে aorta থেকে myocardium এর মধ্যে blood আসবে, okay? Essentially it is the aortic pressure which tries to send blood into the myocardium. But the major problem is that when your heart is contracting, when your heart is in systole, I am talking about definitely ventricle, because ventricle is the major muscle mass, right? Left ventricle and right ventricle. So when your ventricle is contracting, they are squeezing the blood vessel entangled in between the cardiac myocytes. And due to this effect, this blood within the blood vessels, okay, they are squeezed towards the aorta. Instead of coming from aorta to myocardium, we require blood from aorta to myocardium, right? Because your myocardium needs blood, your myocardium needs oxygen, your myocardium needs nutrition, right? But what is happening during systole, your heart is contracting and blood is squeezed back into the aorta. So arterial blood is forced backward towards aorta during systole, okay? And that is a major drawback. Our heart is not getting blood. It is supplying blood to everyone, but it is not getting blood, right? During systole, heart is sending blood to everyone, okay? But it itself is not getting blood. This is the situation, and how to deal with that, okay? So see, this is aortic pressure, okay? Today's topic is very small, but many things to understand, okay? So this part is systole and this part is diastole, and this is aortic pressure, okay? So when aortic pressure is rising, during systole around 120 millimeter of mercury, okay? During systole, the highest pressure point you see, it is 120 millimeter of mercury, okay? 120 millimeter of mercury. During this time, you see left coronary artery flow is down, okay? Because the maximum squeezing effect is happening here, and blood is forced back towards aorta instead of coming from aorta through coronary artery to myocardium, okay? So this time the squeezing effect is maximum, and during systole left coronary flow is falling, okay? And during diastole, okay, this squeezing effect is not here, okay? During diastole, this squeezing effect is not here, and your myocardium is getting blood, okay? So the contradiction is that all of your organs are getting blood during systole, but your left ventricle is such an organ which is getting blood during diastole, okay? So during systole, your ventricle is not getting blood, it is suffering from ischemia during systole, right? So if we consider left ventricle, it is not getting blood, it is coming to zero, see, almost at the beginning of systole, it is falling to 0, no blood supply absolutely, okay, during systole. But in diastole, it is sharply increasing and your left ventricle is getting some blood, okay. Okay, now come to another thing, we will calculate the perfusion pressure separately for left ventricle and right ventricle. The situation is not the same for right ventricle. Your right ventricle is still getting blood in systole and also in diastole, right? But the tragedy is with left ventricle, it is not getting blood during systole, but it is getting adequate blood during diastole, okay. Okay. So, to calculate when and how your ventricles are getting perfused for both left ventricle and right ventricle, you need to know the pressure head at each point, at each ventricle, okay, at each point and at each ventricle, okay. So, let us first know the pressure head in each of the chambers of heart, okay. So, you have RV, RA, LA, LV, right, okay, and aorta is being originated from your LV. How much is the pressure in aorta during systole and diastole, may I ask you? Aortic pressure কত in systole and in diastole? Yes, 120/80, okay. So, in aorta pressure is 120/80, okay, during systole and during diastole. Now, tell me how much is the pressure in LV during systole and during diastole? Any idea? Yes? More than 120, okay. Anyone? In systole or diastole, what? In systole, and in diastole? Okay. So, this systolic pressure in aorta, 120 mm of Hg, it is generated due to contraction of your left ventricle only, okay. The same pressure is being transmitted to aorta, right. So, here also pressure is 120 or slightly more than 120, okay, and the diastolic pressure is 0, right, 120 by zeros, because your ventricle is relaxing, no pressure, your ventricle is relaxing. Then why in aorta pressure is 80? Why in aorta pressure is 80? Because of elastic recoil, right, because of elastic recoil of your aorta. Your aorta is made up of elastic tissue, tunica adventitia, tunica media, tunica intima, jana ache to, okay. So, your aorta is made up of lots of elastic tissues, okay, elastin and collagen, and aortic wall can stretch and can recoil, okay, and this recoil is creating the diastolic pressure, okay. But your left ventricle, it pumps 120, it relax, pressure 0, clear. So, similarly, if we talk about right ventricle, and from right ventricle we have pulmonary artery, okay, right ventricle, pulmonary artery. What is the pressure in pulmonary artery? Systolic pressure and diastolic pressure. What is systolic pressure in pulmonary artery and diastolic pressure is in pulmonary artery? Just like in aorta, it is 120/80. I already told that systemic circulation is a high resistance circulation, okay. If it is pressure head is 120/80 in aorta, in pulmonary artery it will be quite less, okay, and the pressure heads are in pulmonary artery, it is 25/9, 25 mmHg by 9 mmHg, correct. So, pulmonary artery is originating from RV, right? Pulmonary artery is originating from RV. So, what is the pressure head in RV? Now, we can tell, I guess. In RV, pressure head is systolic by diastolic? Yes, 25 by 0. Clear? 25 by 0. Okay? Okay. In our discussion, left atrial pressure and right atrial pressure are not required, but still you need to remember the pressure head in left atrium and right atrium as well. In your right atrium, pressure is 0 to 5 mmHg and your LA pressure is 8 to 12 mmHg. Okay. This pressure in right atrial pressure 0 to 5 mmHg, it is also called central venous pressure. It is also called central venous pressure, and we can clinically measure it by jugular venous pressure, JVP, right? Okay. Left atrial pressure 8 to 12 millimeter of mercury, we cannot measure it directly. We need to have a special catheter called Swan-Gons catheter. With this, we can measure the left atrial pressure, and left atrial pressure is also called pulmonary capillary wedge pressure. Pulmonary capillary wedge pressure, or PCWP, pulmonary capillary wedge pressure. Okay. Anyway, for our discussion for coronary circulation, what we need is the left ventricular pressure and right ventricular pressure. Okay. Now, remember the previous formula. What I told is mean arterial pressure minus intra-organ pressure. This is the perfusion pressure that will work everywhere. Okay. So, what I mean to say is aortic pressure, that means during systole it is 120 and during diastole it is 80. Okay. Aortic pressure, it is trying to send blood to myocardium, right? But these pressure heads inside the left ventricle 120 0, 25 0, these pressure heads, they are resisting it. Clear? Okay. Now, say talk about left ventricle. What is happening in left ventricle? Okay. What is happening in left ventricle? In systole and in diastole. What is happening in left ventricle? So, during systole, aortic pressure is 120, which is trying to send blood to myocardium, and left ventricular pressure, intra-organ pressure. I am applying this formula. Okay. Pressure minus intra-organ pressure. Okay. The pressure which is trying to send blood to the organ and the pressure which is trying to resisting blood to that organ, right? So, during systole, what is happening in left ventricle, left coronary artery? Okay, it is not left ventricle, it is actually left coronary artery, LCA, right? Left coronary artery. So, this aortic pressure, as because your coronary arteries are originating from here. Okay, the coronary arteries are originating from here, the base of the aorta, correct? So, during systole, this 120 millimeter of mercury, it is trying to send blood to organ, send blood to left ventricle, right? But inside the left ventricle, okay, what we told, inside the left ventricle, the pressure is 120 by 0. So, during systole it is 120 and slightly more than 120, we can consider it 121, okay, slightly more than aortic pressure inside the left ventricle, we can consider it 121, okay. So, it is coming as -1, okay, millimeter of mercury, okay. During diastole aortic pressure is 80 and intra-organ pressure is 0. So, what is happening in left coronary artery? During systole, there is absolutely no pressure difference that will send blood to right coronary artery, that will send blood to left coronary artery, right? During systole there is no pressure head, okay, and not even equal. 120 minus 121, it is minus 1. That means some blood moves back towards aorta. Instead of supplying left ventricle through left coronary artery, some blood is moving back. The pressure head is working in the opposite direction, okay. The pressure head is working in the opposite direction. Some blood is snatched from left ventricle to aorta, okay. Left ventricle में blood supply तो बिल्कुल ही नहीं हो रहा है, ऊपर से some blood is channelized back to aorta, okay. So left ventricle is suffering ischemia during systole, but in diastole the pressure in aorta is higher than the left ventricular pressure, and the pressure head 80 millimeter of mercury, 80 minus 0, that is 80 millimeter of mercury. With this pressure head blood is being circulated through left coronary artery and to left ventricle. So your left ventricle is getting adequate blood during diastole. Clear? So what I am calculating over here, this 120 minus 121, it is actually the perfusion pressure, okay, it is actually the perfusion pressure, okay. So in left ventricle during systole perfusion pressure is minus 1, that means no blood will be supplied to left ventricle, rather some blood will be snatched from left ventricle to aorta, right, okay. And during diastole the pressure head is quite high, plus 80 millimeter of mercury. So always during diastole there will be blood supply to left ventricle through left coronary artery. Now let us see what is happening in right coronary artery. What is happening in right coronary artery during systole and during diastole? What is happening in right coronary artery? Again the perfusion pressure, as the pressure is both left coronary artery and right coronary artery, they are originating from the base of the aorta, okay. Again the pressure head which is trying to send blood to right ventricle is 120 during systole, and during systole this pressure is 25 inside right ventricle, right, inside right ventricle. So perfusion pressure for right ventricle during systole is 95 millimeter of mercury, and during diastole perfusion pressure is 80 minus 0, that is 80 mmHg. So see, your right ventricle is in quite a better position, right, quite a better position, and it has got many advantages over left ventricle, okay. एक तो your left ventricle is having more muscle mass, ऊपर से throughout the cardiac cycle इसको blood नहीं मिल रहा है, ठीक है, and your right ventricle is having less muscle mass, but it is getting blood both during systole and diastole, right. Your right ventricle is having less muscle mass, but still it is getting blood in both systole and diastole. And what is happening in systole? In systole the perfusion pressure is much more, 95 millimeter of mercury in comparison to 80 millimeter of mercury during diastole, okay. So left ventricle is not getting blood in systole, ऊपर से some blood इससे लिया जा रहा है, right, and for right coronary artery, for right ventricle, it is getting more blood during systole with the perfusion pressure of 95 millimeter of mercury, okay. So this is why all the ischemic events like myocardial infarction, okay, you know myocardial infarction, right. So these things are common for left ventricle. Your left ventricle is more prone to have ischemia, right. Heart attacks or myocardial infarction, these are more prone to develop in left ventricle, okay, because already in normal heart your left ventricle is not getting blood in systole, okay, and not only that, blood is flowing in the opposite direction from left ventricle to aorta, not aorta to left ventricle, okay. So your left ventricle is very much vulnerable to develop ischemia, okay. Okay. Now सच में ऐसा है क्या? Your left ventricle যদি এতটাই vulnerable হতো, right? তাহলে তো খুব frequent আমাদের heart attacks আসতো, ঠিক আছে? So there is a way out. Okay, so there is a way out. What is that? So this way out is that আমরা প্রথমেই ডিসকাস করেছি, okay, was afraid of needles. Okay, the baby girl was afraid of needles, and there was sympathetic stimulation, right, causing vasoconstriction in all the vascular bed, and the answer was for coronary artery and for cerebral arteries it is minimally affected. Okay, coronary artery and cerebral artery, these are minimally affected. So still there is some way out. Your heart protects itself. Okay, your heart protects itself from getting ischemia. Okay, even if this pressure heads, they are not supporting left ventricle. This perfusion pressure heads, they are not supporting left ventricle. Okay, but heart has got its own regulation. We call it auto-regulation. Okay, auto-regulation is there in cerebral circulation, auto-regulation is here in cardiac circulation, auto-regulation is also there in renal circulation. Okay, but here in heart we have very prominent auto-regulation that resists this deleterious effect on heart. Okay, this dangerous effect on heart. Okay, so how does that auto-regulation works? This auto-regulation works in a very wide range of 60 to 200 millimeter of mercury mean arterial pressure. Okay, এই auto-regulation টা কাজ করে from 60 to 200 millimeter of mercury mean arterial pressure. এতটা wide range এ auto-regulation টা কাজ করে. Okay, মানে whatever happens to your body, sympathetic stimulation হোক বা এরকম প্রেসার হেডের এরকম প্রবলেম, এটা তো আছেই অলরেডি, whatever be the situation, প্রেসার বাড়ুক কমুক, ঠিক আছে, your heart automatically regulates its circulation so that blood supply to left ventricle is minimally affected or almost not affected. So how does that takes place? Okay, so if I consider that girl, what was happening? Okay, the girl was afraid of needle and there was sympathetic stimulation, and the coronary circulation is supposed to get vasoconstriction. Okay, হওয়ার কথা কিন্তু হচ্ছে না. Okay, কেন হচ্ছে না? Because the effect of sympathetic stimulation is high heart rate. Okay, so immediately whenever the baby is anxious, frightened, there is sympathetic stimulation and increase in heart rate. Okay, and increase in heart rate means your cardiac muscles are working more. How does that takes place? At the expense of ATP. Okay, so much more ATP is required. Okay, your heart is using more energy when heart rate is high, contractility is high. So more ATP consumption. More ATP consumption means ATP will break down to adenosine. Okay, and this adenosine, here is the game, this adenosine is a potent vasodilator. Okay, even if your sympathetic system is trying to constrict the coronary vasculature or coronary circulation, okay, the local metabolite adenosine particularly, okay, not only adenosine, adenosine is the major metabolite. Other than adenosine we have CO2, we have H+, we have potassium ion. All these are vasodilator, but the most prominent and most potent vasodilator is adenosine. Okay, and this adenosine is resisting the vasoconstriction effect, vasoconstrictory effect by sympathetic stimulation. Okay, and here this metabolic effect wins over sympathetic stimulation. Okay, so this is called reactive hyperemia. Reactive hyperemia. Okay, so if this question comes, coronary circulation, you need to you need to mention a little bit of anatomy of coronary circulation, right coronary artery, left coronary artery, its branches, origin, कौन कहाँ पर supply करता है, right. So after this anatomical part, you need to write the challenges in coronary circulation, that within the muscle mass the blood vessels are entangled, and during systole, due to effect of ventricular contraction, these blood vessels are squeezed and blood flows back from ventricle towards aorta. Okay, this is the major challenge. Then you need to explain all the pressure heads and calculate the perfusion pressure for both right coronary artery and left coronary artery, and you need to show that your left coronary artery or consequently your left ventricle is not getting blood in systole, okay, but it is being supplied in diastole. Okay. Okay, even if these challenges are there, we have local autoregulation. Okay. So whenever there is sympathetic stimulation, all of your blood vessels are constricted in your cutaneous circulation, in your hepatic circulation, renal circulation, in your pulmonary circulation, but two circulations are spared due to autoregulation. One is cerebral circulation and another is what we are discussing right now is the coronary circulation. Okay. And that local effect is due to sympathetic stimulation, heart rate is increased, contractility of the heart is increased, okay. Heart is using more energy in the form of ATP, ATP is getting broken down, okay. So there is formation of metabolites like adenosine, which is a potent vasodilator, and it is resisting the constriction effect of sympathetic stimulation and it is winning, okay. So instead of vasoconstriction in the coronary circulation, instead there is vasodilation, okay, and it is maintaining adequate blood to left heart, okay, it is maintaining adequate blood to left ventricle, okay, clear. So this is how autoregulation takes place. So if you get a long question, total coronary circulation, okay, or you may get some explain why type of questions, okay, explain why type of question, why your left ventricle is not getting adequate blood in systole, okay, or compare the coronary circulation in systole and diastole, okay, and what is the autoregulation, or simply a short note like autoregulation in heart, okay. Okay, so whatever I told, if you remember, that's enough, okay, that's really enough. You don't need to study anything extra from your book, but definitely you will go through your book and you know, accordingly integrate your knowledges, right.